my name is Debbie, and I'm going to be doing a head-to-toe physical assessment on you, and we're just going to start with your head, and I'm going to have you tilt it forward a little bit, and I'm just feeling and observing, looking at your scalp to see if there's any moles or bumps, lumps. Okay, now I'm going to start with your lymph nodes, your occipital, your postauricular, your preauricular, your tonsillary, your submaxillary, submental, superior cervical, inferior cervical chain, supraclavicular, and infraclavicular. Okay, now we're going to move from there, and I'm going to look at your ears and assess your hearing. I'm just going to start over here with your right ear. And what I'm looking for is the eardrum should be, your tympanic membrane should be white, and it is, with the umbo and the malleus. Now I'm going to look at your other ear. And what I'm looking for is, again, the tympanic membrane, the umbo, the cone of light. Now I'm just going to palpate the outside of your ears to make sure there's no lumps or bumps also in here. Okay, we're going to test your hearing, and this tuning fork is actually a 512 Hertz tuning fork. I'm going to hit the tuning fork, and I want you to tell me if you hear sound either side or if it's the same. Can you hear this the same on both sides, or is it stronger in one than the other?
Same.
Okay, I'm going to test your conductive hearing on the bone. So I'm going to strike the tuning fork, I'm going to put it on your bone, and you tell me when you don't hear it anymore, and then I'm going to move it up in front of your ear, and again you're going to tell me when you don't hear it anymore.
Okay.
And again, when you don't hear it anymore.
Okay.
Okay, I'm going to do it again on this side.
Okay. Okay.
Okay. Now we're going to move on to your eyes. And I'm just assessing your cranial nerves 2 and 3. And then we'll move on and test your cranial nerves 3, 4, and 6. So I just want you to look straight ahead at the light. Good. Now I'm going to see if they're consensual. Good. Now I want you to, I'm going to cover this eye, look straight ahead. I'm going to have you cover this eye, look straight ahead. Okay. Now I'm going to see how your eyes do with accommodation. I want you to look right here at the tip of the ophthalmoscope. Now I want you to focus on the ducts on the wall. Now I want you to look back to the ophthalmoscope. Good. Now we're going to look inside your eyes and check for a red reflex. We're going to turn off the lights. And we're going to start with this side. I see a red reflex, and I want you to just look straight into the light, and I'm looking for the macula, the veins and arteries, the disc, and I'm going to do it again on the other side. Just look straight into the light. There's a red reflex, and again I'm looking at the disc, the optic nerve, the veins and the arteries, and a nice yellow-pink color. Now we're going to turn the lights back on. And now we're going to do what's called the cranial nerves 3, 4, and 6. So I want you to look at my finger and hold your head still. Just follow my finger. This is cranial nerve 6, known as nystagmus. This is cranial nerve 3. Cranial nerve 4, Now we're going to do the same on the other side. Cranial nerve 6, cranial nerve 3, cranial nerve 4. Good. Now we're going to move on and we're going to look inside your nose and your mouth. So just want you to tilt your head back a little bit, and what I'm looking here for is color, and I'm looking for polyps. I'm looking at your turbinates, and again on this side, same thing. We're also looking to see if your nose is midline with your face and even with your ears, so you don't have a mediastinal shift. And now we're going to test cranial nerve number 1. So I want you to, first I want you to collapse one of your nostrils with your finger. Breathe through it. Okay, now collapse it with your other hand on the other side. Can you breathe through that? Okay, now I want you to close your eyes. Do the same thing with your finger. Collapse one side of your nose and tell me what this smells like.
Cinnamon.
Okay, now I want you to do it on the other side and tell me what this smells like.
Clover.
Good. Now we're going to move on to some cranial nerves on your face, and we're going to do motor cranial nerves 7 and 12, and these are your motor neurons on your face. I want you to just look straight ahead, and I want you to try to open your eye, or I'm going to try to open your eyes. You try to keep them closed. Try really hard to keep them closed. There you go. Now I'm going to have you look up. I'm just going to look at your conjunctiva. I want you to look down. Okay. Now I want you to blink, puff your cheeks, smile, show your teeth, stick out your tongue, move it laterally, like from side to side. Okay. Now we're going to, I'm going to have you close your eyes, and we're going to assess cranial nerve number 5. And so I want you to tell me if this is soft or sharp.
Soft. Sharp. 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 Soft. Sharp.
Okay, you can open your eyes. We're done with that. And we're going to move on to your mouth. And I'm just going to have you open your mouth, and I'm going to look at your tonsils, your gag reflex, and your uvula in the back of your throat. So I'm going to have you open wide. Say ah.
Ah.
Okay, now I'm going to look at the sides of your mouth. And under your tongue. Thank you. And I'm also going to just palpate the inside of your mouth. Do you need a drink, or are you okay? Okay. I'm just palpating again for sores. I'm going to look at your lips. Again, some sores or palpitations. Look at your lips here. Good. Now we're going to assess cranial nerve number 4. I want you to close your eyes and stick out your tongue. And I'm going to put a drop of something on there. Does that taste, what does that taste like?
Sweet.
Okay. I want you to open your eyes. I want you to shrug your shoulders. Good. Thank you. Now we're going to move on to your spinal cord, and we're going to do some upper and lower extremity stuff. I want to first look at your hands. Your fingernails are the window to the inside of your body. That looks good. I'm looking for asymmetrical, dryness, abnormal shape. Turn your hands over and assess that. I'm going to feel and look at your arms and assess for any moles. There's one right here that probably needs to be watched. And I'm going to feel musculature. Okay, thank you. Now I'm going to move on to, I'm going to have you close your eyes, and I want you to tell me if you can feel as I touch these areas.
Yes.
That's C4,
Yes.
T1,
Yes.
C6,
Yes.
C8, L2.
Yes.
That's L4.
Yes.
L5.
Yes.
S1. Now we're going to move on. You can open your eyes, and we're going to palpate your, I'm going to do a cap refill sign first. Just going to make sure. Good. Good. Now I'm going to fill up your arteries. These are your radial, brachial, carotid. Just going to do one at a time so I don't make you pass out. I'm going to do your popliteal. Your dorsal pedis. And your posterior tibial. Going to do the same over here. Going to fill for your popliteal, dorsal pedis, posterior tibial. Now we're going to move on to reflexes. And just relax your arm. We're going to do your brachial radius. I'm going to do your bicep. Let's try that again. Okay, now I'm going to do your tricep. Okay, you can relax that arm. I'm going to do the same thing here. Relax your arm. I'm going to do your tricep here. Okay, you can relax that. I'm going to do your patella, your Achilles, patella, and Achilles. Okay. Now we're going to do something called vibrational sensation, and this is a fine sensory that your spinal cords will also be able to pick up. And so what I want you to do is close your eyes and tell me, okay, I'm going to be using a tuning fork that's 512 hertz. That's a hearing tuning fork, but I'm going to substitute it for a low hertz, about a 128 for vibratory. So when I want you to close your eyes. What does that feel like?
Vibration.
Okay, we're going to do it again.
Same thing.
Okay. Good. Now I'm going to do something that's called proprioception. And what I'm going to do is I'm going to have you close your eyes. And I'm going to position your thumb, and I want you to tell me if it's up, down, or sideways. I'm going to do this with each thumb and each toe.
Up, down, down, sideways, up, down,
Okay.
up, down, sideways, down, sideways, up.
Good. Now we're going to move on to the front, and I'm just going to, this is a cardiac assessment that I'm going to do right now, and I'm just looking to see if I can see any pulses, and I don't. What I'm also going to do is just step over here, and I'm going to listen for heaves or feel for heaves or thrills. These would be murmurs. And now I'm going to percuss over your heart. Okay, now I'm going to listen to your heart and your valves. I just want you to relax. This is your aortic, pulmonic, second pulmonic, tricuspid, and your mitral. Now I'm going to go back up and I'm going to listen with the bell of my stethoscope. Mitral, the apex, tricuspid, pulmonic, aortic. I want you to take a deep breath and hold it. Let it out. Take a deep breath and hold it. Let it out. Now I'm going to listen over your temples for a bruit. Just relax. And I'm going to do it on the other side. Just relax. Okay. Now I'm going to move on to your lungs. And I'm just going to inspect your chest to see if there's any distress, like nasal flaring or retractions. I'm also going to measure the expansion of your breath. A deep breath. Take a deep breath. Okay. Now I'm going to percuss over your lungs, so just relax. I'm going to go under here. And the other one. Now I'm going to listen to those same areas, and each time I put my stethoscope in a different area, I want you to take a deep breath. Here. Deep breath. Deep breath. Deep breath. You need a break. Deep breath. Okay, let it out. Deep breath. Deep breath. Should take a deep breath. Deep breath. And again. Deep breath. Deep breath. Good. Okay, I'm going to also do the same thing, only I'm going to do it on the back side. So I'm just going to have you turn and look that direction, and while you're that way, I'm going to look at your thyroid again. Okay? Swallow. Thank you. Now I'm just inspecting your back to see if there's lumps, bumps, or anything on your skin that needs to be watched. I'm going to percuss just like I did before. And I'm just looking for consolidation, tumors, a pneumonia. Now I'm going to listen over those same areas. I'm going to have you take a deep breath whenever I touch you. Deep breath. Let it out. 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 And deep breath. Let it out. Now I'm just going to palpate over, or percuss over your kidneys. I want you to tell me if this is tender.
No.
Okay.
No.
I want you to turn and look at me. And now I'm going to have you lay back on the pillow at a 45-degree angle. And I'm just going to look again to see if you have any pulses in your neck. And you do have a little bit of a pulse bilaterally. There's no JVD. I'm also looking at your abdominal area to see if I can see an aortic pulse, and I can see a pulse right here. Now I'm going to listen to your heart again in this position. Here. Compare it to your carotid artery. Would you look that direction just a little bit? And they should be synchronous, and they are. Okay, just look up ahead. Now I'm going to do a breast exam, so I'm going to have you put your hand up over your head. And start in the axillary area, and I'm just going to rotate, try to feel for any masses, because men can also get breast cancer, especially if you have a history in your family. And then I'm just going to feel for your lymph node. Okay, we're going to do the same thing over here. And we're also going to feel for this lymph node. And that feels good. You can put your arms down. Okay, now I'm going to have you put your arms to your sides. And I'm going to listen to your stomach. I'm going to listen for vowel sounds. Your upper quadrant, lower left quadrant, lower right, upper right. Now I'm going to listen for bruits. Right renal, aortic, left renal, left iliac, right iliac, and because of videotaping purposes, I'm not going to do this, but I would feel for his femoral pulse and actually listen over his right and left femoral for also bruits in that area. So we're just going to move on from there, and I'm going to lightly palpate your stomach. Kind of a pushing scoop. Okay, now I'm going to press deeper. I want you to tell me if it's tender over your liver or your gallbladder. Gallbladder. This is your pancreas and your spleen, your kidney and intestine, your bladder, kidney and intestine, and your stomach. Any tenderness in those areas?
No.
Okay. Now I'm going to steal your pillow for a second, and I want you to, I'm going to look again. I want you to raise your head to your chest, and I'm going to look for any hernias in these areas. Palpate down through here. Okay, you can relax again on the pillow. Now I'm going to percuss and see if I can find your liver border. And what I'm listening for is tympani. Okay. Right here is your liver. So we're going to mark that with a pen. And we're going to measure that. Now we're going to start up here. Should be also a little resonant or tympani. Okay, right here. That's also a liver border. We're going to mark that. We're going to do the same on the other side, only we're looking for a splenic enlargement. So same kind of sound. Tympanic. Okay, it's a little more consolidated. It's dull. So right around in this area. Okay. Now we're going to move on to we're going to do some range of motion with your legs. So I'm going to flex at the hip. I want you to flex your leg all the way as high as you can. Now I'm going to flex your knee. I'm going to rotate it internally. I want you to tell me if it hurts in your knee or in your hip. There's a little knee click. We're going to extend your leg. I want you to rotate your foot. I'm going to do the same thing on the other side. I'm going to flex your leg. I'm going to bend your knee or flex your knee. I'm going to rotate it out. Any pain in your hip or your knee?
No.
Rotate it in. Okay, extend your leg. I want you to rotate your foot in a circle. And now I'm going to check for a Babinski reflex. I'm just going to have you cross your legs right there. And what we should see is your toes fold over. Let's try that again. Okay, we're going to try it on the other side. An abnormal Babinski would be a lift of your big toe and a fan of your small toes. So we're going to see if we can get that. Okay, try that again. Okay, we don't have a fan, but we don't also have curling of the toes. And I think we're going to call it good. I appreciate your time, and that concludes our physical assessment.